Hi, I'm Courtney Jones. Each year, the Indianapolis Coalition for Patient Safety recognizes hospitals and health networks across central Indiana for best safety practices. Today, we're going to visit with Community's 2008 Patient Safety Hero Awards nominees and winner.
We formed this about 5 years ago with the major healthcare systems in Indianapolis, including Community, Clarion, St. Vincent, St. Francis, the Veterans Administration, and Wisher. And we have actively been pursuing to try to make Indianapolis the safest place to get health care.
Lori Cutrope was nominated for improving medication safety and decreasing door-to-balloon time at the Community East Cath Lab.
Well, the Quiet Zone's been a great invention for us. Dr. Bingle and I have been making safety rounds here at East Cath Lab once every month for about a year. And he made a recommendation that at Methodist, they were using the Quiet Zone and very successful with it. So I said, well, let's try it. And Cath Lab is a very busy, high strung place because we have life and death and obviously routine cases. So we trialed it and we love it because in that 30-second opportunity, we have the opportunity to stop, think, and react before we choose our medicine, and nobody can bother us. That's wonderful. That means no phones, no doctors can talk to me. They have to wait outside the red zone, which is wonderful.
Randy McIntyre believes the Quiet Zone has made his work environment safer.
Since then, we have decreased our med errors, and also we have relabeled certain syringes so that they all don't look alike.
And how have you worked to decrease door-to-balloon time?
Well, in the last year, we can say very proudly that all of our cases are under 90 minutes. And that's from the time the patient walks in the door in the ED, great teamwork from the ED with us. And then the cardiologist opens up the vessel with the balloon, and that's when the clock stops.
Our second nominee, Gigi Acevedo Patterson, was recognized for leading the effort to improve safety metrics in inpatient psychiatry.
Our leadership team has really embraced an open communication so we can develop a trust so our staff will understand that we all need to perceive safety as our #1 priority in caring for our patients.
Trudy Hill nominated Gigi for truly transforming the culture of safety in behavioral care.
I've seen a huge change in the attitude of the staff. The last time the safety coaches met, there was a great I can do it and teamwork approach to safety, and we have seen the results in the events of harm. And this is in a very challenging patient population where not only do we need to provide safe care to our patients, but we have to anticipate the patient's behaviors and try to save them from themselves.
Betsy Heart was nominated for implementing the Surgical Site and Patient Identifier Initiative at community surgery centers.
About mid-2008, Shannon came to me and asked me to do the education for the OR staff here at the Surgery Center North about surgical site verification, the timeout procedure, and the 2 patient identifiers. So this mandatory education was in response to a similar policy that was being enacted throughout the network.
Well, Betsy's really invaluable not only to the North Surgery Center but to all the surgery centers as a whole. One of the main things she does is ensure that practices learned at one site are shared throughout all the other sites. So you can go to any of the 5 Indiana surgery centers within Indianapolis and pretty much be following the same policies and getting the same level patient care.
And now the winner of the 2008 Patient Safety Hero Award at Community, the North NICU.
There were several things that we initiated in the NICU to make it a safer environment. I would say 3 of the most important things. One would be the alarm management, which information technology played a huge role in, and that allows us to transfer the baby's monitor, their alarms from their monitor to the nurse's badge. The second was the noise monitoring and circadian lighting that we have in every room. In the NICU, with our noise monitors, we're able to keep our decibel level well below 50, usually in the 45 decibel range, which is very, very good for our patient population. The other thing that we did that was very important is we installed scrub sinks at the entrance to every door to the NICU. Since we've been here in this NICU, our infection rate has gone from 1.5% down to 6.57%. And just to give you kind of some statistics on that, the average infection rate, according to the Journal of Pediatrics, for NICUs is 6 to 25%.
Scott Lakin helped develop the NICU's alarm system, a first in healthcare.
With the help of different companies, IT companies, and General Electric's alarm management, we were able to utilize our Vocera system to send those alarms to the badge rather than to in the room, where Denise had said the noise level needed to be reduced. Since implementing this, we've had multiple hospitals from outside the Indiana area come to see what we've done here as a model for success, and most of those people have gotten back with me that they've implemented at some level. Within the network, we've moved the same technology to emergency departments where certain critical cardiac alarms can be sent to badges so that the staff know, regardless of where they are in the department, that there's an emergency in a particular room.